When we are doing our training, they just bung in some salt water and they say, I'm giving 20 milligrams of S-Ketamine or 50 milligrams of ketamine. And they look at the instructor and say, is that okay? And the instructor jumps into it in the deep end of the pool and says, yeah, that sounds good, right?
Yeah, because he doesn't have experience either.
They don't get any training out of it. So one of the good suggestions I've heard is that utilize your vets. I think it was you mentioning it.
Yeah.
I'm quite sure that a lot of vets are using ketamine or something like ketamine, where at least our medics could get hands-on delivering a drug and looking at the effects.
So I think
same with all drugs. Yeah. The same with all drugs, right? You give insulin. What do? You measure blood sugar, right?
Yep.
You give a pain treatment. What you should do is measure your VAS score before and after. You should do that, and you should document it. The same with if you're going to go into deep sedation with ketamine, you decide on a dose. As you say, you've got to have a plan. Where do I want to go with this dose? You've got to say, I want 1,000-yard stare in nystagmus, and I'm prepared to bump it up if he doesn't get there, right? You have to have a measurement. You have to have some objective way of deciding what to do. This is what you're talking about. And when they don't have experience, then they're going to have problems.
Yep, exactly. Yeah. So I think sedation with ketamine, super easy. If you have a really panicked situation, a great big bump of ketamine, slowly, hopefully, we'll settle it. But where I think is a lot harder is just analgesia. You don't want to snow him. You want to just calm him down some, take care of the pain, understand he's going to keep talking, he's going to keep moving around, but you have to have a way to assess, did you actually take care of the pain or did you miss your mark and now he's in the middle of that curve, How, as an anesthetist, as somebody who's worked in austere situations, how did you kind of work that with?
That is because they are not trained either to give drugs properly. When you give a drug, you have to look at effect. And if you can first expect effect after 20 minutes or 30 minutes, then you have to check it after 20, 30 minutes. If you give it IV, we know the effect is there in 1 or 2 minutes.